Welcome to IVC. We look forward to helping you live as healthy and active of a lifestyle as possible. Our team is committed to providing you with state-of-the-art personalized care. IVC is nationally accredited with board-certified physicians who are fellowship trained in vascular and interventional radiology. Interventional radiologists are on the cutting edge of clinical advances and use the latest image-guided technologies in the treatment of many medical conditions that once required open surgery. You will also work closely with our experienced nurse practitioners, nurses, physician assistants, technologists, medical assistants, and office staff. IVC is committed to helping you through each step of your care, and we hope this video will help you better understand vertebral compression fractures and your treatment options. What is a compression fracture? Compression fractures typically occur in the setting of underlying osteoporosis, which weakens bone structure. Compression fractures may be secondary to a notable traumatic event, such as a fall, but may also occur with something as simple as sneezing. Some patients may not be able to fully identify an exact time when the fracture occurred. The spine is made up of many vertebral bodies stacked on top of each other. Muscles and ligaments attach to the vertebrae and provide stability and facilitate movement. Compression fractures may cause significant vertebral body deformity and loss of height. It is also possible that pieces of the bone may project backwards into the spinal canal, causing compression of the spinal cord and critical nerves. Vertebral bodies typically become weaker with age due to osteoporosis. Healthy vertebrae can also fracture when subject to intense trauma, or less commonly, when a tumor involves the bone. Compression fractures are most often diagnosed in post-menopausal women, though they're not uncommon in older men as well. What are symptoms of a compression fracture? Pain from compression fractures may present immediately after a traumatic event or may worsen over time. Pain due to a compression fracture is often severe and disabling. Descriptions of the associated pain include dull achiness of the spine at the level of the fracture, pain with bending or twisting, inability to tolerate sitting, standing, or walking, numbness, weakness, or tingling in the legs, inability to control bowels or bladder. Patients may feel some relief by lying flat in a bed or wearing a back brace. How is a compression fracture diagnosed? A healthcare provider will review your past medical history as well as perform a thorough physical exam. MRI is typically obtained to evaluate fracture severity, timing, number of vertebrae involved, presence of fracture fragments in the spinal canal, vertebral body height, and feasibility of treatment. In situations where MRI is contraindicated, a nuclear medicine bone scan along with a CT scan may be performed to obtain similar information. How are compression fractures treated? Treatment options are determined on a case-by-case basis, considering patient age, unique anatomy, fracture severity, and the degree of osteoporosis. Initially, the patient will undergo a short trial of conservative therapy, which includes bed rest, pain medication, back brace, physical therapy. If conservative therapy does not provide sufficient symptom relief, or if pain requires hospital admission, then cement augmentation of the fracture using procedures called vertebralplasty or kyphoplasty may be considered. Vertebralplasty is performed using fluoroscopic X-ray guidance. An interventional radiologist guides the treatment needle into the fractured vertebral body and injects bone cement that binds and stabilizes the fracture. The cement stabilizes the bone within a few minutes. After the cement is injected, the physician will remove the needle and a small dressing will be applied over the skin access site. Kyphoplasty is similar to vertebralplasty, but utilizes a balloon or other augmentation device to help restore height to a compressed vertebral body. Cement is then used to bind and stabilize the fracture. Advantages of cement augmentation include short procedural time, minimally invasive, performed as an outpatient, can quickly return to activities as tolerated. If the fracture is caused by a tumor, a more extensive workup and invasive approach to treatment may be needed. This may include referral to an oncologist, tumor biopsy, and radiation therapy. Here are a few treatment tips to keep in mind as you prepare for your procedure. Wear comfortable clothing to the procedure. Eat a light meal the evening before your procedure. Don't eat or drink less than 6 hours before treatment unless directed by your doctor. Over-the-counter pain medication is typically all that is needed after the procedure. While recovering, stay active but avoid heavy lifting. Reach out to your treating doctor with any questions or concerns. In the setting of osteoporosis, working with your primary care provider is important to help strengthen the bone and prevent further progression of osteoporosis. As with any medical procedure, and in spite of our efforts to keep you safe, there are known potential associated risks with the treatment of compression fractures, including infection, bleeding, and cement leakage. Infection risk is minimized by our use of strict sterile techniques. You will be instructed to keep the needle access sites clean and dry for several days after your procedure to help prevent infection. Antibiotics may be prescribed in select cases to further reduce infection risk. Please let us know if you have undergone heart valve or joint replacement surgery, or if you have other conditions that may require pre-treatment antibiotics. Bleeding is usually minimal and can typically be controlled by applying local pressure. If you're taking a blood thinner for another condition, we will typically have you hold the blood thinner for several days before your procedure. Please let us know if you're taking any blood thinners, including aspirin. Cement leakage may occur from cement leaking into fracture lines. This is typically of no clinical significance, but may occasionally impinge on an adjacent nerve. This risk is minimized by using imaging guidance to perform the procedure. Vertebroplasty or kyphoplasty do not definitively prevent development of additional compression fractures at other levels, particularly in patients with severe osteoporosis. If you develop a new onset of pain, additional imaging may need to be repeated to determine if there are new fractures and if further treatment at other levels is necessary. And finally, in spite of undergoing a technically successful procedure, your symptoms may persist, reoccur, or even worsen. For most patients, however, the benefits of treatment outweigh the potential risks. Please let us know if you have any other questions regarding the potential risks of compression fracture treatment. Conclusion. Pain from compression fractures can be very debilitating, which can limit your ability to perform even normal daily activities. Fortunately, with the help of our team of specialists and state-of-the-art diagnostic and treatment tools, you can generally achieve significant relief of symptoms. You'll have time to consult with us in greater detail before any procedure we perform. If you have any questions or concerns, or if you experience a complication following a procedure, we want to hear from you as soon as possible. Our providers are on call 24 hours a day and can be reached after hours through our office number at 801-379-6700. If you'd like more information about our specific treatment process, visit ivein.com or ask one of our providers. We hope this video has helped you better understand compression fractures and the associated risks and benefits of treatment. If you have any questions or concerns at any time, please ask one of our providers or office staff members. Thank you for your attention. We look forward to working with you.